The pandemic has had a major impact on all of us, and that includes the disabled community. Joining us once again this morning is Mary Brogan with the Health Department's Developmental Disabilities Division with details on how exactly the state is helping. Good morning.
Good morning.
Thanks for joining us once again. And for those who don't know, let's break down what exactly is the role of the Department of Health's Developmental Disabilities Division.
So we're a division in Department of Health that provides services for over 3,000 people statewide. These are people who have significant intellectual and developmental disabilities and major functional limitations in their lives, need our services in order to live successfully at home and to participate in the community. And our goal is to help this population to have the lives that they want, just like anybody else.
Right. And of course, the pandemic has had a big impact on all of us, but also the disabled community. So what exactly have been the impacts and what have been the biggest challenges?
So among the biggest challenges is knowing how to give people a way to connect with others and instilling that sense of hope. And now with the trend toward fewer cases of COVID in the community and more opportunities to get vaccinations, while we can't let our guard down, our participants and families are really starting to look forward to more of their service programs being open. They are people with a lot of underlying health conditions, a lot of vulnerabilities as a result, and the vaccine is giving them that hope to have more opportunities to see their friends and to be in the community. And many of them have worked for years on gaining independence. So the pandemic has interrupted many of those life trajectories and goals. So again, that access has been so important for so many.
Right. And what exactly is the Department of Health or their partners doing to impact or to help those that have been impacted?
So since the first announcement of the vaccine being approved, we've been very actively working with our partners, working to help get people registered for vaccine pods, such as at the Woodward Health Center. And then a subset of our population live in congregate settings or are homebound and can't get out to a pod at all. They're basically homebound or bedbound. And since the emergency use authorization hit December 11th, I remember that day, we've been partnering with Dr. Curtis Toma, who's the medical director at the MedQuest division, and other leadership in long-term care. And we've created a very unique partnership with local independent pharmacies. And these are pharmacies such as KTA on the Big Island, on Oahu PharmaCare, Times, 5 Minute, Foodland. And they've just been incredible. More recently, Don Quixote has signed up to be in our initiative, in our partnership. And what they're doing is going house to house and doing basically house calls, providing the vaccine to our program participants and their primary caregivers in homes. And it's been just a remarkable partnership. And I think only in Hawaii we could do this kind of work together. And we continue to do it to make sure the most vulnerable people don't get left behind in this.
And that does sound like an amazing service that you guys are offering through those partnerships. So for those who are maybe interested in finding out more information, or if they want to, again, be a part of that, where exactly can people with disabilities go to get the services?
So for our overall services, we do have a website. I think that you all will post that link. But we also have an intake office, Department of Health, and that number is 808-733-1689. That's 808-733-1689. And there's also a coordinated entry system called Hawaii Cares, and you may have seen those ads. But that number is 1-800-753-6979.
All right, perfect. And if you missed that, we will have a link to their website as well as have that phone number on our website at khon2.com, and we'll link you on over to that. But thank you so much for joining us this morning, Mary, and we'll hope to see you soon.
Thanks for having me.
Of course,
Okay.
happy to have you.